But we begin with the popularity of mommy makeovers. Having a baby is probably the biggest joy of your life, but it does take quite a toll on your body, especially if you breastfeed. But there is a way to get that pre-mommy body back. And joining us now with more is Dr. James. Say your last name for me, Doctor.
Knoetgen.
Thank you so much for that. I appreciate it. He's a certified plastic surgeon at a Beautologie Cosmetic Surgery Center and Med Spa here in town. And we really appreciate you having you here because I know there are a lot of women that are interested in this and maybe even going under the knife for makeover procedures. Do you see that becoming more and more popular among women these days?
Yeah, it definitely is, not only here in Fresno and in California, but nationally. And like you say, after having a pregnancy and giving birth and breastfeeding, it can definitely take a toll on a woman's body. So while it's very important to eat well and live a healthy lifestyle, sometimes the pregnancy and the childbirth can stretch out skin and muscles that can't be treated just with exercise or dieting. So that's where a procedure like a mommy makeover may come in.
And what's the #1 procedure that women are asking for right now?
Probably breast augmentation, but also tummy tucks and liposuctions are very popular as well.
Why do you think there are people out there that are kind of, well, still scared about maybe doing something like this procedure?
Sure. Well, it is surgery, so people do undergo anesthesia, and with every surgery and every anesthesia, there are certain risks involved. And that's why I think it's very important for people who are looking to have cosmetic surgery that they have it done by a fully formally trained plastic surgeon who is board certified in plastic surgery to make sure it's done very safely.
And so tell us a little bit about your center and your med spa and how it differs from other centers and other places that we may be familiar with.
Sure. Well, I'm a fully trained board certified plastic surgeon. I've been practicing for about 13 years, and I work at the Beautologie Medical Group, which started in Bakersfield, and now we have offices in Malibu, and our newest one is here in Fresno. And we're focused on getting to know our patients on a one-on-one individual basis to find out exactly what they want and what they're looking for, so we can tailor a surgical plan to meet their needs and help them achieve their goals.
What are some of the newest advancements, and really how has this type of surgery changed here in the past couple of years? Because I know it has, and it has rapidly, hasn't it?
It has, and probably the biggest change is in the breast implants. The newest breast gel implant is a cohesive silicone gel implant. Some people call it the gummy bear implant.
Okay.
The older silicone gel implants were made of more of a liquidy type silicone gel, so if the implant were to rupture or leak, some of the liquid could actually leak out into the breast pocket, whereas the current cohesive or gummy bear type implants are more solid. They're kind of like a Jell-O or a brie cheese. Exactly. So if they crack, they're not going to leak out.
So when you say old, how many years ago were we using the old type of silicone?
Well, the newer ones are on the market for just the past several years.
Oh, okay.
The FDA just re-released them several years ago. At first, they were just used for breast reconstruction, but now they're used for cosmetic aesthetic surgery as well.
So the one next to it is the saline. Now that one's, well, in the years past, has gotten a lot of rap, bad rap.
It's been around for a long time, and it's a very safe implant. This is just, you can see, it's just filled with saline, which is just IV fluid out of an IV bag, so it's very safe. So if the implant does leak, it's just salt water that's going to be absorbed by the body, and the woman knows that the implant's leaked, and she can just come in and have it exchanged.
Now, how do you know which one is for each woman? Like, how do I know which one's right for me if I was interested in breast augmentation? Well,
that's where the whole consult process comes in. It's very important to sit down with an experienced board certified plastic surgeon, and for a woman to be honest and say, here's what I'm looking for, this is important to me, this is not what's important to me, this is the type of shape or size I'm looking for, and then to do an exam and find out exactly what she's starting with, and then we can talk about the pros and cons of each implant and find one that's going to fit her individual needs and her individual goals.
But there are pros to both.
Exactly.
And they're just, it's a matter of one's own decision when they sit down and talk to you. Now, is it better, do you think, Doctor, to wait until you have all of your children before getting that surgery?
It depends on which procedure you're talking about. For a tummy tuck, then it's definitely best to wait till a person's done having their children before having a tummy tuck. And then for implants, it just depends on their timing. So if someone's planning on having a child in the next year or two, probably best to wait until after they're done with that. But if they're going to be spacing it out over several or many years, then it's good to talk about it and figure out exactly what's most important to them.
What about mammograms if you have breast implants?
Yes, well, the breast implants are made so that they can withstand a mammogram. It's very important for a woman to get her mammograms when her primary care provider suggests it. So absolutely, they should be getting mammograms. And and we place the implants underneath the muscle so that the mammogram can see the majority of the breast tissue, and so it's not blocked by the breast implant.
Recovery time for both tummy tuck and breast augmentation,
Sure.
what's that like?
For breast augmentation, it's actually pretty quick. We use a lot of numbing medication in the breast, so most women are back to work within 3 to 5 days, and then back to exercising within 3 to 4 weeks. A tummy tuck's usually a little bit longer, usually about a week off of work and then about a month off of exercise.
And does it leave a big scar?
It's actually a low scar, so we
Okay.
put it as low as possible on the front of the body, so it's covered by most clothing.
What about some women who kind of bounce back into shape okay, but they still have a little loose skin left over?
Exactly.
What do you recommend for those women?
Well, if they eat well and they exercise and the skin is still loose and the muscles are still loose, that's actually the perfect candidate for a tummy tuck because they're at
Oh,
a good
really?
body weight.
Okay.
So the tummy tuck is going to tighten up the skin on the front of the belly as much as possible, tighten up the muscles, and we usually do a little bit of liposuction on the sides just to help contour as well.
Well, that sounds really fascinating, and I know that a lot of women may be interested in this, so call that number that you see on your screen, 476-4462, because I'm sure there are a lot of questions out there and a lot of people
Absolutely.
with a ton of questions on this, right?
Yeah, and we love meeting with people individually on a one-on-one basis to answer all their questions and keep them informed.
Now, are consultations free? Can I walk in and talk to you and then decide?
Absolutely.
And
There's
about
no rush.
how much is it going to run, or does that depend?
It completely depends
Okay.
on exactly what procedures are involved, what
Okay.
implants they choose, but the consultations are always free. We like
Okay.
to sit down and spend a lot of time with people and talk to them, show them before and after photos, and let them make up their mind, no rush.
And can you do both at the same time?
Yes, that's
Really?
what the Mommy Makeover is. Exactly.
So that would be the Mommy Makeover.
Right, the
to
Mommy
do both.
Makeover is usually a breast augmentation with a tummy tuck and a little bit of liposuction, but there
Wow.
can also be a breast lift involved, just depending on what she wants.
And that's why it's important to go in and talk to the expert like
Exactly.
yourself. Okay, so you are located on Fir Avenue here in Fresno. Whereabouts is
Yes.
that, doctor?
It's off of Herndon and Cedar.
Okay, okay. And if you want to make an appointment, call that number on your screen. You could also
Absolutely.
visit them online as well, I'm sure. So 476-4462. Thanks so much, and welcome to Fresno.
Oh, thank you
are
so
you
much.
from this area?
No, I'm from New York, but my wife's from California, and our family is here now in Fresno, so we're very happy to be here.
All right, happy to have you here. Thanks so much, doctor. All right, coming up on Central Valley today, the UCP's Community Garden that's getting a boost from a local ag store. How everyone is benefiting from this partnership. Details coming up next.